Hi everyone, I'm Dr. Karam, board-certified facial plastic surgeon, founder of Karam MD Skin. I specialize in facial rejuvenation, which means I help people look as young as they feel. And today we're going to talk about a topic that I've been getting hit up a lot on DM on Instagram, and that is, what are my thoughts on Zac Efron's facial transformation and his description of what has happened to cause it. And it's got actually a lot of people concerned that the nature of his injury potentially causing these changes could happen to them. And I wanted to break this down a little bit and analyze it with you all. So here's the story. So 2021, pictures of Zac Efron came out showing a markedly different jawline structure. At that time, rumors were spitting and flying about the fact that he potentially had some type of jaw implants or facial fillers. And obviously as the media goes and as fans go, there was a lot of split opinions about whether they liked the changes or not. And that's really not the purpose of this particular video. It's not a subjective issue, but it really is why that happened. So in October issue of Men's Fitness, Zac Efron addressed those rumors and those concerns and basically took us through the events that led to it. And he described that prior to that point in time, he had been running around in the house with socks, slipped, hit the edge of a fountain, passed out, woke up with apparent jaw injury at the level of his chin. And shortly after that, he began to see changes in his overall facial muscles, which led to thickening of his jawline and other facial muscles. So as you can imagine, chin injuries and slips and falls are very, very common, and it's natural for people to be concerned about whether or not these are indeed a change that can happen after these injuries. Or is this really just a denial of any type of cosmetic procedures, etc.? I mean, really, what's the root cause of this? And the explanation, does it add up, basically? So I thought we'd take a few minutes here and just kind of break it down and look into it. First of all, as a strong disclaimer, I don't take care of Zac. He's a very, very handsome guy before or after this transformation, but I do want to give you some opinions about whether or not I think this thing could happen, this sort of facial hypertrophy could happen after injury. And of course, we're always going to give the benefit of the doubt that, of course, this is truth, and that the human body is a mystery and anything can happen to anyone, even though it doesn't potentially have a medical explanation per se. So let's break it down. So let's first of all take a look at Zac's pre-injury areas of concern. You can see here in this photograph, slender jawline, yet masculine, chiseled, and in this particular view is where the masseter muscle normally is. It's in the edges of the jawline. It's a normal muscle, so it actually gets bigger, just like any other muscle does, through work essentially. And sometimes people who clench a lot and chew a lot will see masseters get bigger with time. So just keep that in mind. Now here is the recent photos, and you can see there's a overall significant change in the face. Specifically, the masseters are quite a bit bigger, but also there's some changes that you see throughout the face as well. The lips look a little bit bigger, the cheeks look a little bit fuller. So it's sort of an all-around change, which many of the fans have been up in arms about, that these changes couldn't be from an injury, but let's break it down. So looking at these before and afters, you can see that there's a significant change. Now, as I said, I'm a facial plastic surgeon, which means reconstructive surgery was a big part of my training, a big part of my history, and I've spent a lot of time dealing with jaw injuries and jaw fractures throughout my days in the hospital, and we've repaired a lot of them. And so one thing that I've never seen or heard about in any of my years of experience is that there's this post-traumatic inflammation or hypertrophy of the muscles. So I took it to the literature to see if, naturally there's rare cases or things that I'm missing. And my search through the literature review brought up some cases of what were considered idiopathic or without explanation or benign masseter hypertrophy. However, in those case studies, the changes usually involved one side of the face, not both, and certainly not in a symmetric fashion. And these were truly case reports, meaning that they're like one case that somebody saw and decided to report to the literature because they're so rare. But a generalized facial fullness I have not seen in the literature, at least not in the review that I did, and certainly none that would explain cheeks and lips and those particular areas. Now, looking at this, purely from a likelihood perspective, if I didn't know anything, we didn't hear this explanation, I would assume that there's been some fillers used. These are common areas where people, especially men, like to add a little bit of fullness to their jawline to add strength. We see this a lot in people who do jawline contouring. And I always warn people that, when you get fillers in this part of the jawline, and this is specifically true for women who are trying to improve the jawline, you always see those images on the profile, which look absolutely beautiful, a big improvement. But when you see the person on front view, the jaw gets really, really big. And this is a look that can happen with facial fillers being put into that particular area. Also, the jawline implants, which are actually placed almost basically like a permanent way at the level of the jaw, can create this type of overall effect where it creates a more masculine shape. The other changes, normally speaking, those would be assumed to be related to fillers and things like that. But there's always a number of different causes that can cause these type of overall changes to the face. Again, very, very rare conditions, and it sounds like he's working with some specialists to identify potentially what those causes are and hopefully have a chance to improve them. Now, for those of you who might have some masseter hypertrophy related to the normal changes that happen, which is related to clenching at night if you have TMJ issues, or if you're somebody who likes to chew gum, or just naturally have kind of a heavy masseter, the best absolute treatment for that particular problem is the use of Botox directly injected into the muscle. Botox decreases the firepower of a muscle, and as a result shrinks the masseter into a significantly reduced size. So for a lot of women especially who feel that their masseters are a little too strong, a little too masculine, regular Botox injections, typically twice a year, is enough to create that atrophy and a slender jawline. So know that that's always an option, and a very, very good option as well. All right, folks, so again, I can't speak specifically, I can't give you my strong opinion about whether or not this is related to it, and I don't think that's really the point. We always respect everyone's privacy. If they want to share, they can share. If they don't, they don't. But for those of you who've been kind of concerned that a hit in the jawline or a fall or whatever could cause this, do not be afraid, do not be too concerned. It's extraordinarily rare, almost to the point of, like I said, I couldn't find anything specific on that in my literature search, so you don't have anything to worry about on that. But again, be careful, don't slip and fall, because head injuries and all the nose injuries and things like that can definitely happen. So be careful about that, but don't worry about the consequences. All right, folks, I would love to hear your comments about this video, and if you have any thoughts to share about Zac's transformation, please feel free. We'll get a fun dialogue going there. But again, Zac is a handsome guy, one way or the other, and we respect his privacy, and we appreciate his candor in talking to the media, and especially to his fans, about your speculations and concerns. All right, folks, if you haven't already, make sure you hit subscribe to hear more content about facial rejuvenation and skin rejuvenation. Share and like it. We'll get this out. And until next time, Dr. Karam. Thanks so much.